Coming up on a Humankind special, tens of millions of Americans are living on the edge. Over a third of the country lacks sufficient savings to handle a $400 emergency, and the effects can be devastating.
Being poor puts your body in a constant state of stress, and we know that releases certain hormones and reactions in the body that cause us to age faster. The drain that poverty has on the health of a person, it's not just the drain on that individual, it's the drain on their family, it's the drain on their community.
And being poor can be spiritually discouraging. People end up feeling vulnerable and even invisible. We'll consider the history of this problem, as well as policies from Social Security to Obamacare that have come to the aid of people in a precarious position. I'm David Freudberg. Stay with us for Living on the Edge from Humankind. Humankind is produced in association with WGBH Boston and Documentary Educational Resources. This special project, Living on the Edge, is supported by the Humankind Program Fund. Why in the wealthiest of countries do so many Americans struggle to make ends meet? You're listening to Humankind. I'm David Freudberg. There are people in this world so hungry that God cannot appear to them except in the form of bread, said Mohandas Gandhi of India, who worked to uplift his people from rampant poverty. By contrast, the United States is the richest country that has ever existed. Yet even in this land of plenty, the poor have always been with us. Mark Rank is professor of social work at Washington University in St. Louis.
What happens when you look over the course of people's lives is that things happen that they didn't anticipate, like losing a job, getting sick, a family splitting up, having a pandemic occur. When these things happen, they're very much at risk of falling into poverty.
Which occurs far more often than many people may realize, especially in these times of head-spinningly rapid economic changes.
Between the ages of 20 to 75, 60% of Americans will experience at least 1 year below the official poverty line, which is a very conservative measure. And 75% of Americans will experience either poverty or near poverty. You know, and people ask me, how could these numbers be so high?
In part because tens of millions of Americans are barely getting by as it is. We saw this at the height of the pandemic when community food pantries were suddenly swamped with long lines. The precarious condition of people undergoing hard times was dramatized by Michelle Pfeiffer as the title character in the 2017 film Where is Kira? Here she visits her ex-husband, humbly asking for a loan.
I mean, you know how hard I've worked, and it wasn't my fault that, they downsized me out of a job.
That was 2 years ago.
And ever since then, I have been looking every day. I don't even know how many resumes I've dropped off.
There are other jobs,
I know that. I have tried everything. And am reduced to handing out flyers on parked cars and praying every day that I even have that.
The statistic about, 35% of Americans don't have $400 in case of an emergency shows you that there are many people right on the edge. The expression of living paycheck to paycheck applies to that 35% of folks, that they are just barely making it, and if something happens, it's like a domino effect, and it will throw them into poverty.
And as documented in Mark Rank's recent book, The Poverty Paradox, the safety net may not offer as much protection as we might expect.
There's not a lot out there to protect people. The United States is really steeped in this idea of rugged individualism, that, you do it on your own, you don't depend on others, you certainly don't depend on the government, and that's the way it is. And so, if stuff happens to you, good luck. You're largely on your own.
She only has two.
This is a food pantry run at a church in Watertown, Massachusetts, Currently, it's open once a week for 4 hours.
They really need help. A lot of these people we're getting a lot of new families. We got about 15 in line.
The pantry offers cereals, good bread, canned beans, some fresh foods, milk, eggs, rice, soda, hamburger helper, and other items. Lining up at the back door are mothers with young children, or the working poor, some people who've given up looking for jobs, older adults on a fixed income. When the emergency declaration for COVID-19 expired in early 2023, benefits for many families were cut back. That's when the pantry noticed a stream of new patrons flowing in. Would you be willing to chat with me for a minute?
Go ahead.
How often do you come here?
This is my first time.
First time. And why were you motivated to come?
Because these jobs out here don't give us enough hours to work for them. CBS is not the job for me, but other than that, they don't give enough hours for us to do.
So have you been working at CVS?
I still work from part-time, but 1 day a week is not enough.
And they don't have more hours available?
Nope.
Does that feel stressful to you?
Yes. Looking for something like for 20 hours a week and stuff like that, Monday through Friday. You're home and with everybody else and you're not working, we need the money. It's not the hours or anything like that. We need the money.
Well, I work, but I only come if I'm very low on food. And
Is that the case today?
yes. So I just, if I need it, I come. I don't come just for the sake of coming, because I know there are people that, really need food. And the people here know me, and they know that I only come when I need it.
You say you work. May I ask what you do?
I'm PCA, personal care attendant.
So you take care of older people?
Yes, I do.
And how many hours a week does that take up?
I only work 20 hours.
Okay. And that can be hard work.
I've been doing it for 40 years.
Would you say that you're experiencing a situation where it can be a little difficult to make ends meet?
Definitely, especially with the price of things going up. I have my son and my daughter-in-law and my granddaughter live with me, and because they have no place to go, and trying to support them, and they're looking for jobs, and my son just got a job, thank God, but meanwhile the supplements, what we can't buy, Yeah, this is a great place.
We serve about 80 to 100 families every week.
Do you come here as a volunteer?
Yeah, I'm a volunteer. Since I retired, it's my mission to feed hungry people. I retired 13 years ago. I've been coming here for 13 years.
Why is limiting hunger such a passion for you?
I'm a member of this church, which is the United Methodist Church, and it was founded by John Wesley, who basically wanted to serve the poor.
Well, you're carrying on his essence and his mission.
My children need 3 square meals a day. Now my children need 3 square meals a day. My children need 3 square meals a day. Lord, and I ain't gonna be treated this way.
Woody Guthrie in 1940, when millions went hungry in the Great Depression. Financial distress can sap the spirit. People may feel vulnerable and invisible. Today, nearly 40 million Americans are living in poverty, as measured by the Census Bureau. These include over 11 million children, and 1 in 3 older adults is considered economically insecure, even with Medicare and Social Security, according to the National Council on Aging. Mark Rank.
Within the United States, we've often thought of poverty as an issue of us versus them. And the them, are various groups, but when we think about poverty, we often think of folks that are living in inner cities, folks that are people of color. Somehow they're kind of out groups. And that's the way we've always kind of thought about poverty. The deeper sort of question with that is that, individuals are basically to blame for their poverty.
If you're laid off through no fault of your own, or if you get sick, you could still end up at the food pantry. And of course, some people do find themselves in dire straits as the result of poor decisions they've made. But we've all made regrettable mistakes, sometimes whoppers. The difference may be that for people living on the edge with very little cushion, it's much harder to bounce back.
Rather than thinking about poverty as an issue of them, we really need to think about this as an issue of us.
A principle that was embraced by the Biden administration as America grappled with the public health crisis of the pandemic. But as Mark Rank points out, even before COVID-19, there were a lot of misconceptions about people who are struggling.
Most folks in poverty, white, black, Hispanic, do not live in inner cities. Some do, and poverty is quite high there. But there's more folks in poverty living in suburban areas, and really the most sort of deep entrenched poverty is actually in rural America. So places like Appalachia or the Mississippi Delta or American Indian reservations, those are places that have actually the highest rates of poverty. But we often don't think about that when in our image of, who is poor, where does poverty reside? And, part of that may be kind of out of sight, out of mind.
But it was difficult to be in denial when America hit the low point of the Depression. A fourth of workers were rendered jobless. From director John Ford's 1940 film The Grapes of Wrath, in which an Oklahoma tenant farmer was expelled from his home because the landlord determined it was no longer profitable.
We couldn't do on any less than what our share is now. Well, the children ain't getting enough to eat as it is, and they're so ragged.
I can't help that. All I know is I got my orders. They told me to tell you to get off, and that's what I'm telling you.
You mean get off my own land?
Now, don't go to blaming me. It ain't my fault.
Whose fault is it?
You know who owns the land, the Shawnee Land and Cattle Company.
And who's the Shawnee Land and Cattle Company?
It ain't nobody. It's a company.
They got a president, ain't they? They got somebody who knows what a shotgun's for, ain't they?
Oh, son, it ain't his fault because the bank tells him what to do.
All right. Where's the bank?
Tulsa. What's the use of picking on him? He ain't nothing but the manager. And he's half crazy himself trying to keep up with his orders from the east.
Then who do we shoot?
Brother, I don't know. If I did, I'd tell you. I just don't know who's to blame.
Well, I'm right here to tell you, mister, there ain't nobody gonna push me off my land.
We are examining poverty in America. You're listening to Humankind. I'm David Freudberg. For more information about this segment, Living on the Edge, and to obtain audio downloads or CDs, please visit humanmedia.org. And you can send us an email, all at humanmedia.org. Today, a large swath of our population is squeezed by the impacts of income inequality. The Economic Policy Institute in Washington calculates that the top 1% of Americans now hold a record share of earnings, while the bottom 90% has hit an historic low.
The growing gap between the rich and the poor in this country is a direct result of policy decisions, not the immorality and the lack of personal work of poor people.
Reverend William Barber, now at Yale University, leads the Poor People's Campaign.
Policy decisions made here in Washington and in our state capitals, but those decisions have been supported by well-funded myths. Corporate interests have sent their representatives here to preach personal responsibility and the danger of government intervention. But the truth is we must take a collective responsibility for the inequality, the unjust laws and systems created. God did not make us poor. Greed and abuse and power make us poor.
The U.S. Constitution in Article 1 tasks Congress with providing for the general welfare. And much of today's anti-poverty insurance system was formulated by the U.S. government in the Depression, when the lifetime savings of many Americans were wiped out. To the chagrin of congressional opponents, these basic safeguards became woven into the fabric of American life. Democratic President Franklin Roosevelt in 1935.
This Social Security measure gives at least some protection to 30 millions of our citizens who will reap direct benefits through unemployment compensation, through old age pensions, and through increased services for the protection of children and the prevention of ill health.
But a half-century later, the pendulum had swung in the opposite direction. Republican President Ronald Reagan in 1987.
Last year, in my State of the Union message, I called for an overhaul of our welfare system. Since that time, I've sent to Congress a carefully designed package of proposals that rejects the old federal approach of sweeping solutions dictated from Washington.
For millions of Americans, though, the crucial protection of medical coverage was significantly left out. In an attempt to fill that gap, the Clinton administration in the 1990s proposed grand plans, but lobbyists for the insurance industry and others pushed back. Ultimately, it was under the Affordable Care Act, which passed in 2010, that about 20 million people, including many low-income Americans, gained access to health care. President Barack Obama at the White House signing ceremony.
This year, tens of thousands of uninsured Americans with pre-existing conditions, the parents of children who have a pre-existing condition, will finally be able to purchase the coverage they need. This year, insurance companies will no longer be able to drop people's coverage when they get sick. Or place They won't be able to place lifetime limits or restrictive annual limits on the amount of care they can receive. This year, all new insurance plans will be required to offer free preventive care. And this year, young adults will be able to stay on their parents' policies until they are 26 years old. That happens this year.
The new law, which came to be known as Obamacare, did have its problems, notably with the rocky rollout of the ACA website in 2013. Republican opponents waged a fierce fight over the requirement that all eligible adults purchase an insurance policy. A public option offering a Medicare for All model was thwarted in congressional negotiations. In time, though, despite its limitations, the benefits of Obamacare are now supported by a solid majority of Americans, and the program was never dislodged. But Obama's Republican successor, Donald Trump, did try.
Tonight, I am also calling on this Congress to repeal and replace Obamacare.
Republican Senate leader Mitch McConnell.
7 years after Obamacare was imposed on our country, we will vote on the critical first step to finally move beyond its failures. Many of us have made commitments to our constituents to provide relief from this failed left-wing experiment.
But the Trump administration and its congressional allies were never able to agree on a feasible replacement. They faced many of the twists and turns that had confronted Democrats earlier, when painstaking negotiations gave birth to the Affordable Care Act. Donald Trump at the White House addressing the nation's governors in 2017.
It's an unbelievably complex subject. Nobody knew that health care could be so complicated.
And when Senator John McCain of Arizona, then battling cancer, gestured his famous thumbs down on the floor of the Senate, Trump's attempt to topple Obamacare was doomed. For all of its intricacy, the Affordable Care Act did bring many tangible benefits, which even some skeptics eventually embraced.
In Maryland, there was a program that offered some limited assistance for folks who didn't have insurance.
Physician Keisha Davis is the health officer for Montgomery County, Maryland. She remembers conditions before the state accepted Obamacare's Medicaid coverage for needy Americans.
You got, I think, around 6 primary care visits a year, discount on medications, some limited labs. which for a patient who has a lot of health problems, that really isn't much. It doesn't go very far. And when the Affordable Care Act was enacted and Medicaid was expanded, that, by the stroke of midnight on January 1st, converted over to Medicaid. And I remember having a conversation with a patient who actually was not in favor of the Affordable Care Act, and she was on this program, and we were struggling to try and get her a CAT scan and some specialized medications, and she was going on and on about Obamacare and how she didn't think that was a good thing. And I just stopped her and I said, you do realize that you are one of the people who is going to benefit, and after this is in place, this test that we are trying to get and these medications that you need, you will now have access to. And she just stopped in her tracks and she said, oh, I didn't realize it was going to benefit me. And so, I definitely saw the transition, especially in a place like Maryland that expanded Medicaid early on and very robustly, the difference that it made in patients being able to access the care. It didn't take away all of the struggle, but it certainly made things a little bit easier in how we treat and the access that they have to the medications and specialists and labs and studies that they need.
Earlier in her medical career, Dr. Davis made a commitment to serve low-income patients.
After residency, I joined a community health center outside of Baltimore, and that's really where you saw the effects of poverty. Many of our patients were immigrants who had no insurance, and so they were, getting by on our sliding fee schedule. And it was in Howard County, Maryland, which, while being one of the richest counties in the nation, also had, like many other well-to-do counties, had these pockets of poverty, of folks who are often unseen. And so patients really dealing with that stress of, here I am in a place where folks all around me have resources and they don't, struggling to get their medications, get their food, having to make decisions on, do I get this prescription, or do I get gas, or do I get food? And so really having to help patients navigate that landscape.
This is Arlington Eats, a nonprofit serving a different Boston suburb. Their free market, which is staffed mostly by volunteers, is available to any resident of Arlington, Massachusetts, an upper middle-class community. Funded by donations and grants, the market is open 11 hours a week and features an impressive selection of fresh produce. I met a woman here named Hope Joint. She was born in Kenya, Africa, living in the United States now for about 16 years. She said her 3 children have special needs due to birth abnormalities.
One is turning 18, and the other is 14, and the youngest one is 11.
And are they in some kind of a special education course?
They are not in school, so they have therapies that come at home.
Hope said they live in subsidized Section 8 housing but still pay $1,000 for monthly rent. That's a considerable discount for this part of the Boston area. She can't afford cell phone service, so a neighbor takes messages for her. Typically, Hope visits Arlington Eats once a week.
When you walk into a pantry, I think it's a cross-section of people. People who've been in professional lives and have lost their jobs for whatever reason. I was reading the paper and I saw massive layoffs at Google. Who knows what they have on their plate? Now, with that gone, how are they going to make ends meet, right? They're probably going to find themselves in a situation like us, but for different reasons with different factors. A person like mine is medically driven. This is what drew me here and interfered with my personal dreams. Dreams myself to develop myself and do things I would have wanted. I wake up in the morning and I wish I had done this, and I wish I had done this. I wish I'd finished college. And it's not for lack of wanting or lack of drive or lack of motivation. This happens.
For an earlier episode, I visited a different pantry with my microphone. I noticed that patrons there wouldn't make eye contact with me, apparently ashamed that they needed this kind of help. Some people report being constantly watched and scrutinized. A certain social stigma attaches to recipients of this assistance.
One time, a friend of mine was homeless, and their child said something in school that they were homeless, and the teacher said, oh, that's because they are lazy. We're never really understanding how they got there, why they were homeless, what happened. It's just a cultural perception, right? And I think for us in that situation, you either have to look at it and say, how do I get myself from out of this and keep trying every day and not give up, in hoping that an opening will open up.
What kind of opening do you think might open up for you, or what are you hoping for?
I just want my kids to be able to have meaning in their lives. As a mother, that's my first thing. I have to take care of. I mean, when we don't, you can see what happens in the street when children are not supervised and run into the wrong group, and what happens. Yeah. So for me, I think that's my priority first before anything else, and that priority then dictates when and where I can go to work.
Let's talk about job opportunities for people who are trying to lift themselves up economically. How hard is it for poor folks to obtain decent jobs in this economy?
If you look at the United States over the last, 40, 50 years, what's happened is that we've actually done a fairly good job in terms of creating jobs.
Mark Rank of Washington University.
Our rates of unemployment, although still too high, are much lower than in many other, for example, European countries. So we've done pretty well in terms of creating jobs. The problem is that more and more of those jobs that are being created are low-paying jobs and jobs that don't have benefits. So today in the United States, it's estimated that about 40% of all jobs in the United States are considered low-paying jobs. And by low-paying, I'm talking about, below $17, $18 an hour. In addition, many of these jobs do not provide benefits, particularly health care benefits. And so, you can be working at, a job like at Burger King or wherever, certainly full time, and, you're still going to find yourself in poverty. So that's, to me, that's one of the key problems, and one of the key reasons for poverty is that we don't provide enough livable wage jobs that can support folks. And those jobs often don't have key benefits that people need to live a livable life, including health care, retirement benefits, other things as well.
So that sort of compounds the low wage to not have appropriate benefits.
Yeah, that's right. And the social safety net in the United States is incredibly weak. So if you compare what we offer in terms of kind of protections to people versus other countries, we're the only industrialized country that does not have universal health care. I mean, think about that. Basically every other, high economy country provides universal health care. We don't. And the reason is we don't view that as a human right. Most other countries say, you know what, having access to health care is a human right. Here, it's on your own. If you can afford it, great. If you can't, then you don't get anything. And that's kind of the mindset that we have in this country.
Coming up, how the stress of poverty can affect your health. And we listen to moving stories of low-income Americans from a remarkable hearing before Congress, when Living on the Edge continues on Humankind in a moment. This is Living on the Edge, a special project from Humankind. I'm David Freudberg.
There's a term that we often use called weathering, which is the effects of chronic stress on the body. It really just accelerates the aging process.
Physician Keisha Davis outside of Washington, D.C.
Being poor puts your body in a constant state of stress, and we know that releases certain hormones and reactions in the body that cause us to age faster. It relates to elevated blood pressure, to obesity, to diabetes. Many of the chronic diseases that we see are worse by being in constant stress. And I think just the state of being poor and the constant navigation that poor folks have to navigate, waking up early to catch the extra bus to get to a place, am I going to make it back in time from this job to pick my kids up? Those are things, yes, that I think we all have to navigate, but the ability to take a break from that stress when you're poor often doesn't happen.
This relentless challenge was depicted by Will Smith, who starred in the 2006 movie The Pursuit of Happiness. It's about a man who compounded his personal misfortune with a pattern of bad decisions.
This part of my life is called paying taxes. If you didn't pay them, the government could stick their hands into your bank account and take your money.
Dad!
No warning, nothing.
It can't be too late. That's my money. How is somebody just gonna take my money? Listen, that's all the money that I have. You cannot go into my bank account. No.
It was the 25th of September. I remember that day. That's the day that I found out there was only $21.33 left in my bank account. I was broke.
There is not the ability to pay someone to clean your home when things feel overwhelming. There's not the ability to take that weekend getaway to detach from it all. There's often, when you're poor, not even an opportunity to take a full break for lunch. And so that constant navigation, that constant worry about money, how am I going to do this? How am I going to provide for my kids? How am I going to make it from day to day?
Hey, listen, I need the rent. I can't wait anymore.
I'm good for that, Charlie. I'm gonna get it.
Why don't you go 2 blocks over the Mission Inn Motel? It's half what you pay here. Listen, Chris, I need you out of here in the morning.
The hell am I supposed to be out of here by tomorrow?
I got painters coming in.
All right, look, I need more time than that, Charlie.
No.
I'll paint it myself. All right, but I gotta have some more time. I got my son up in here.
And says Dr. Keisha Davis, the unremitting stress of poverty may have other consequences that complicate a person's ability to dig out from under what feels like a mountain of aggravations and insults.
It makes it a lot more difficult to attend to medical issues when they do arise. So having the flexibility to be able to take time off of work when you may not be paid to attend to a medical concern. I'm a family physician. We stress prevention. We want folks to come in proactively. If you're a worker who doesn't get paid when you don't come into work, the idea that you're going to go to the doctor when you're feeling fine and take that time off of work is a really hard pill to swallow. And yet we still want people to be able to have the flexibility to do that preventive care that's so important.
So one effect of poverty is to impose a set of damned if you do, damned if you don't choices. But they're often easier to face for people who have more resources.
When I think about that single mom who maybe has high blood pressure and prediabetes, if I can give her some tools to help her eat a little bit better on a budget, that can help her manage her stress a little bit more, yes, that helps her. That helps her stress. Maybe it helps prevent the progression of her hypertension. Maybe it prevents her from developing diabetes. But it also helps her kids, right? It helps her to teach them to eat better. It helps her to be more accessible and available for them. It helps her to be more accessible and available to her community. And so really, when we're thinking about the drain that poverty has on the health of a person. It's not just the drain on that individual, it's the drain on their family, it's the drain on their community that doesn't get the benefit of having them fully active and available.
In June 2018, activists in the Poor People's Campaign offered powerful testimony before the U.S. House of Representatives about their experiences living with low income.
My name is Amy Jo Hutchison, and I come from West Virginia. And I've never spent a day in my life without poverty on some level. And I think it's really easy for us as human beings to punish people or dismiss people because we don't love them. And we can't love them, we say, if we don't know them. So today I want to turn your attention to Ashley, who is 21 years old, and she has autism. But Ashley is so high-functioning autistic that Social Security says that she doesn't qualify for disability. But yet Ashley's not able to work because her mania it prevents her from being in large crowds, loud spaces. She's tried several times, and she hasn't been able to keep a job because of her disability with autism. I want to talk to you about Frank, who was a Vietnam veteran who sat and told stories to me about elderly people eating cat food to survive. I want to talk to you about Megan, the single mom who told me, I've sold my blood to feed my kids. I want you to think about my own children. I have 2 daughters, and they travel to food pantries with me, and they help me to organize and collect stories. And even my children at the ages of 11 and 14 know enough to know that if you don't eat, you die. I talked to a junior in high school this year in rural county, and she was telling me that there have been 3 suicides in her high school within this year and over 140 fistfights. And I said, why? And she said, everyone's angry. I said, why are they angry? And she said, you can't be poor and you can't be happy at the same time. And I don't know about you, but in my experience living in West Virginia, that young lady that's a junior in high school just described the opioid crisis. I had Medicaid, and so without any notice, they told me I'd forgotten to send a form in February. So this is April when I get the letter. And by the time I received the letter, I had just a couple of days notice that I no longer have health insurance. So please tell me as a poor person what I'm supposed to do. I have a bachelor's degree. I'm trying to heal a medical condition now with essential oils and prayers. While I work full time, I take my kids to the softball games. I'm doing everything that I can. I'm organizing around other poor people, predominantly low income moms. And so I just don't think that we should have to give this much of ourselves in order to have a good quality of life in America, the richest country in the world.
My name is Pamela Roach. I'm from Lowndes County, Alabama, and I live in a mobile home. And I got raw sewage. I don't have no money on power. And I have to travel back and forth to Birmingham to take my daughter with the CPAP machine. Don't have a car and don't have no way to take her. And then we have a high utility bill, and I was paying like $370 a month on the trailer, and it's hard. I couldn't buy my children stuff for what they need.
My name is Christopher Olive. I currently live in Grays Harbor County, which is in Washington State. I am 33 years old and a veteran of the U.S. Air Force. I received an honorable medical discharge in 2007 after 4 years of service, due to complications from pancreatitis, which the VA ultimately determined to be a service-connected condition. Upon my discharge, I knew essentially nothing about the science of addiction and how it works in and ultimately changes the brain. I quickly went from taking my opiate-based pain management meds as prescribed to first slowly overusing them and then moving on to taking as many as I could handle, while at the same time watching everything I thought to be of value in my life slowly slip away. Not just material possessions, but really valuable things like relationships with friends and loved ones alike, and my own morals and values. This led to a 10-year period of drug addiction and periodic homelessness, of which the majority I was homeless. From drug addiction to misdiagnosed mental illness, there seems to also be a lack of compassion and humility. There is little to no access to treatment facilities, transitional housing, or even affordable housing in Grays Harbor County.
We all have the right to live. And we are fighting because this is my child right here, Jimena. Come on, Mama. Get up here. And I want her to grow up in a society where she's able to meet her grandfather who's in Mexico. I want her to grow in a society where she's able to get access to higher education without getting herself in debt. I want her to be able to breathe good quality air. We get the notices from Google, don't go out tonight, or don't go out today, or limit your exercise today because your air quality is bad in Los Angeles. I want her to have clean water, something that in a lot of the communities we don't have. Central Valley in California, people can't drink water, and those are the folks that are working to feed America. Thank you.
Again, Reverend William Barber, co-chair of the Poor People's Campaign, a national call for moral revival.
Our campaign agenda is neither left nor right. It aims to challenge both sides of the aisle. It aims to reach toward the moral high ground. The agenda is rooted in the religious values of the prophet of Isaiah that every legislator ought to hear again since you put your hands on the Bible to swear yourselves into office. Woe unto those who legislate evil and rob the poor of their rights and make women and children their prey. You should hear what Jesus said, not to churches and personal charity, but to nations. When I was hungry, did you feed me? When I was a stranger, an immigrant, did you receive me? When I was sick, did you care for me? Because every nation will be judged by God for how it treats the least of these.
We're exploring the experiences of underprivileged Americans. You're listening to Humankind. I'm David Freudberg. For more information about this segment, Living on the Edge, and to obtain audio downloads or CDs, please visit humanmedia.org. Government assistance to the needy has evolved in the last century. Old age benefits through Social Security and unemployment insurance became national policy in the New Deal. Support then followed for people with disabilities. Over time, the federal role expanded with Medicare for older adults, food stamps and Medicaid health care for the poor, and other programs. Many states also joined in. But some Americans view costly welfare payments as creating dependency by the recipients. Again, Mark Rank of Washington University in St. Louis.
So welfare reform has been going on for like 50 years. This is nothing new. It was, in the Nixon administration, Carter, Reagan. The Clinton administration had a major welfare reform bill that was passed.
When I ran for president 4 years ago, I pledged to end welfare as we know it.
President Bill Clinton, 1996.
I have worked very hard for 4 years to do just that. Today, the Congress will vote on legislation that gives us a chance to live up to that promise, to transform a broken system that traps too many people in a cycle of dependence to one that emphasizes work and independence.
Obviously, certain people will exploit any system of public assistance, just as others can afford to engage lobbyists who manipulate our tax system in their favor. And some folks are caught up in addiction or are diagnosed with mental illness. Overall, though, recipients of welfare stay on these programs for less than a year on average. Mark Rank has studied assertions that the beneficiaries are taking advantage of public funding and have little motivation to get off the dole.
Because it is so little that people get, there's virtually no disincentive. It's not enough. So here's a good example. I did a study to look at, does welfare encourage women to have more children? This is an argument that's been around for a long time, that, maybe because you get more money if you have another child, that's an incentive to have another child. So what I found was that actually the fertility rates of women on welfare were lower than women in the general population. And I talked to a number of women about this, and they said, you know what? You've got to be crazy to have another child for an extra $70 a month. It doesn't make sense. It doesn't make any economic sense. And, how can you disagree with that? It doesn't make any sense. And yet, that idea has driven all kinds of reform measures. Now, if we were providing all kinds of generous benefits, at that point, maybe you'd say, well, maybe there might be some disincentive effects, but that's not the case in the United States. We've got the weakest social safety net of basically any industrialized country.
In his book, The Poverty Paradox, Mark Rank describes how some people are affected by inequality that's handed down over generations. He says some populations receive a cumulative advantage based on family and neighborhood, while others inherit a cumulative disadvantage.
The way that this operates is that if children are growing up in low-income homes, the resources that are available to them in terms of the quality of education they're getting and many other things is quite different than children who are growing up in an affluent background. They're likely to be attending really top flight schools, getting all kinds of resources. And what happens is those advantages or those disadvantages accumulate over time. That's why there's this, if you're growing up in a poor low-income household, you're much more likely to, as an adult, also be struggling because of this idea of cumulative advantage and disadvantage. And the way that I illustrated in the book and in other places is with the game of Monopoly and thinking about, how Monopoly is played. So the standard, let's say we have 3 players. Standard way of playing is that everybody gets, $1,500, and you start the game and you go around, and the roll of the dice and the skill of the players determines who wins and loses. And this is the idea of a level playing field. That's the way we like to think the United States operates. But then I say, let's imagine a game where Player 1 starts out with $5,000 and several properties already, purchased. Player 2 starts out with $1,500, the standard, and Player 3 starts out with $250. Now we're going to play the game. The rules are still the same. Luck is still involved. Skill is still involved. But given these prior advantages or disadvantages, Player 1 is going to win almost all of those games. And that's kind of the reality in the United States. We have children who are growing up, with very few resources and children who are growing up with many resources. And so it's not surprising that that's going to have an effect on how well you do as an adult.
Particularly if educational opportunities are unequal.
Absolutely. And that's another, we talked about kind of the United States as being an outlier. Here's another way that the United States is very much of an outlier. Most countries fund their K through 12 system through kind of a centralized funding. Everybody kind of gets, regardless of the school you attend, everybody is getting roughly the same amount of resources. In the United States, there are wide differences depending on the wealth of the community. So much of school funding comes from the local tax base, the local property base. If you're in a wealthy community, you're going to be able to fund your schools really well. And if you're in a poor community, you're not going to be able to do that. And so the quality of education that students are getting varies widely in the United States. Here in St. Louis, you can go 15 minutes one way, and I can point out a school that has just all kinds of resources, and the students are getting a top flight education. And you can go 15 minutes the other way, and the school is falling apart, and they're struggling to find teachers and resources, and so. There's this vast inequality. And, again, it's like that's going to have an effect on how well people do. And the ironic thing is that we talk about the importance in the United States of equality of opportunity, that everybody should have equality in terms of the kinds of things that can get them ahead in life. And one of those would be education. But it's really a joke that we don't have equality of opportunity at all. We have wide inequality of opportunity, and we ought to call it for what it is.
You know, it's really hard to break out of that cycle of poverty.
Again, physician Keisha Davis, who is African American.
Everybody needs help at some time in their life. And sometimes that help comes from the government, and sometimes that help comes from family and friends, right? The parent who is able to gift their child $50,000, $100,000 to help them purchase a house is a handout, just like that person who is getting assistance or temporary assistance or food assistance from the government. They needed a little help to get by, a little help from our friends. You know, when I think about myself, I am a physician. My husband is, also well-educated, working on his doctorate. And yet, when I look at our white colleagues who are in similar situations, the wealth that they have been able to acquire because their family has a history of wealth is different than what we have.
It's another example of how family background can extend financial advantages or disadvantages to a person's status today.
My parents were the first parents of their generation to go to college. His parents, I think he had a grandfather who went to college. And so their ability to have a stable house, generate wealth, have enough to not only eke out a success for them, but also save up enough extra to give to the kids. That takes generations. And I think African Americans are starting several generations behind. My grandfather's grandfather was enslaved. That wasn't that long ago. It takes generations to recover from that trauma of slavery. My father helped to desegregate schools. He was one of the first class of students to desegregate schools. People think about this as, long ago and far away. That was just a generation ago.
You're listening to Humankind. I'm David Freudberg. Studio recording by Antonio Oliart-Rose. Editorial assistance from Kathy Graham, Ken Rogers, and Rowan Edwards. Webmaster Brian K. Johnson. Special thanks to Laura Carlo, Nick Kausler-Rich, Jonathan All, and Jennifer Weingart. Thanks also to Steve Martin, Jack Clappish, and Tony Buck. Our program is presented by Human Media.
To download an audio copy of this program and access other resources, please visit humanmedia.org. That's humanmedia.org. You can also access our other programs and send us an email from our website. Again, our web address is humanmedia.org.
And you can subscribe to our free weekly podcast, Humankind on Public Radio. This segment, Living on the Edge, is Humankind program number 296.
The executive producer is David Freudberg. This is Humankind.